is polypharmacy. Polypharmacy is taking the same drug unintentionally prescribed by multiple specialists, by patients. Let me explain this. In this era of super specialists, most of my patients, diabetic patients who come to me, are under multiple specialists or consultants. They are under diabetes, under me for diabetes. They will be under a neurologist for some neuro problem, under an orthopedic for some bone problem, under a nephrologist if they have a kidney problem. This is just an example. A good clinician will always go through the prescriptions of the other consultants and take care not to repeat any molecule which is prescribed by the other person. But in practice, it is not so. Nobody has the time to look into the prescriptions or the medications prescribed by the other consultant. The particular specialist who is looking after his own specialty, his own organ, only sees his system. He hears out the complaints by the patients, and most of the time, many medications are prescribed unintentionally just to give symptom relief. And it might have been prescribed by the previous doctor also. So if the patient, unsuspecting patient, if he doesn't have a unifying physician or a unifying doctor or a family physician, he is in trouble. I'll tell you one example. The drug pregabalin we use for nerve pain induced by uncontrolled diabetes. And sometimes the patient will be taking unsuspectingly double or triple the dose of pregabalin which has been prescribed by the endocrinologist, the orthopedic as well as the neurologist. So unless you have a unifying physician who will collate all these prescriptions, who will remove the unnecessary repeated ones and write a final prescription, the patient is in trouble. And another important side effect of polypharmacy is drug-to-drug interactions. There are many drugs which interact or which causes side effects when combined with the other drug. And most of the time, if the treating clinician, whichever specialty he may be, does not elicit the history properly or does not glance through the prescriptions written by the other consultants, then the patient is in trouble. This is called polypharmacy, and it has to be prevented at any cost, because most of the hospitalizations in the hospitals are due to drug interactions because of polypharmacy. So take care and be under a unifying clinician or a family physician. Thank you.